Now, good afternoon. Welcome back to my daily lectures. We are on to the second portion of childhood cancer. This has to do with the questionnaires section, and this is about questions to ask before a test or procedure for the child. So this is what the parents usually think about. So let me just enumerate the questions that a parent would have concern about. So they would be: which test or procedures does my child need? What will the results tell us? Where should my child have this test done or procedure done? How long will the test or procedure take? What will when will we know the results? What does my child need to do to get ready for the test or procedure? What happens during the test or procedure? Will my child be awake? Will my child feel discomfort or pain? Will medicine be given to my child to be helped my child to relax or sleep? What are the risks of this procedure or test? Questions to ask when you receive test results: what did the test or procedure find? Will you explain what the pathology report says? What is my child's diagnosis? What type of cancer does my child have? What is the extent of severity or risk group, grade, or stage of the cancer? Will more tests or procedures be needed? What will these tests or procedures tell us? Will they be painful? Who can give us a second opinion about the pathology report? And next to be concerned would be the risk group, grade, or stage. Planning treatment is of equal importance. So, as an opinion of the patient, it reads as: at first everything was new and confusing. I was overwhelmed. Now I understand more, and if I don't understand something, I ask until I do. Shows the determination of the patient in helping her child, patient's parents, in fact. Depending on the type of cancer that your child has, the doctor would describe the cancer in terms of its stage, grade, or risk group. These systems explained below are used to describe how severe different types of cancer are and to plan the best treatment for each child. Get copies of all test results and reports used to make a diagnosis, as well as a written copy of the child's diagnosis. Now, risk group. For many childhood cancers, including leukemias, patients are assigned to a risk group, low, intermediate, or high, based on their child's age, clinical features of the disease, and results of the lab tests. For example, leukemia risk groups are based on the number of white blood cells, changes in chromosomes, whether the leukemia is spread to the brain, spinal cord. Patients with lower risk disease are more likely to have a good outcome and need less aggressive treatment than patients with higher risk disease. Grade. Other cancers such as brain tumors are often grouped and treated based on what cancer cells look like when examined with a microscope. Low grade, also called well-differentiated tumor cells, look nearly normal under a microscope. They grow slowly and are less likely to spread throughout the body than high grade, also called undifferentiated or poorly differentiated cancer cells. Stage. Treatment for solid tumors such as Wilms tumor, for example, may also be based on the stage of the cancer. Staging systems are using numbers and letters to describe the extent and severity of the cancer. Numbers in stage 1, also referred to as stage 1, numerically 1 or Roman 1. The tumor is usually small and has yet to spread to other parts of the body. In stage 4, also called stage 4 numericals, the cancer is more advanced and has often spread metastasized from the place where it started to other organs or tissues in the body, such as to the bones. Letters. The T&M staging system uses the letters T, N, and M to describe the stage. The letter T describes the size of the tumor, N describes whether or not cancer has spread to nearby lymph nodes, and M describes whether or not metastasis, the spread of cancer to other parts of the body, has occurred. And moving forward, we go to the second opinion. Some parents decide to get a second opinion to confirm their child's diagnosis. Even highly experienced doctors may have different opinions. If you choose to get a second opinion, talk with the first doctor. You will need to get information such as slides, samples, or reports from the hospital where the biopsy was done to give the second doctor for his references to be made. It's common to get a second opinion, and most doctors welcome another doctor's views. Some healthcare plans require a second opinion. Other healthcare plans will pay for a second opinion if you ask for one. If your plan does not cover a second opinion, you can still get one if you are willing to cover the post. The cost, I said. The cost that's posted to you or sent to you. Prognosis. A prognosis is the chance that the cancer can be treated successfully and that your child will get better. It is based on information collected over many years from large numbers of people who were diagnosed with the same type of cancer. Factors that may affect your child's prognosis include the type of cancer your child has, how advanced the cancer is, your child's age, and how your child responds to treatment. As you talk with your child's doctor about your child's prognosis, keep in mind that survival statistics may be based on all patients with a specific type of cancer or only some of them. One statistic that is commonly used in making a prognosis is the 5-year survival rate. This rate is the percentage of people diagnosed with a specific type of cancer who are still alive 5 years after they were diagnosed. Survival statistics use information collected from large groups of people who may have received different types of treatment. Since it takes several years to see the effect of newer and better treatments, these effects may not be reflected in current survival statistics. Because statistics are based on a large group of people, they cannot be used to predict exactly what will happen to your child. Everyone is different. Treatments and how people respond to treatment can differ greatly. Related resources would be cancer staging, pathology reports, tumor grade, understanding cancer prognosis. Next will be talking with your child. As the patient says, my son was old enough and smart enough to be at level with with him about everything. I learned as much as I could about the cancer he had, but mostly I did what parents do best. I loved and was always there for my child. Right, now we deal with hospitals that specialize in treating children with cancer. We found a doctor who specializes in treating the type of cancer that our son has through the Children's Oncology Group, KORAH, a network of hospitals with amazing childhood cancer experts. Our son likes his doctor and we trust her. He's completely onto treatment and is doing well. After learning that your child has cancer, you will need to decide where to have your child treated. Sometimes children are diagnosed with cancer and need to start treatment right away. However, when possible, it's often valuable to seek a second medical opinion. This section helps you learn about hospitals that specialize in treating children with cancer, how to get a second opinion, and tips for working with your children's healthcare team. Choosing where to have your child treated. Most children with cancer receive treatment at places that specialize in treating cancer in children, such as Children's Hospital, University Medical Center, or Cancer Center. Hospitals that have experts in treating children with cancer are usually member institutions of the Children's Oncology Group, KORAH. KORAH is the world's largest organization devoted to clinical research to improve the care and treatment of children and adolescents with cancer. Children's Oncology Group, member institutions. KORAH, member institutions. Treat more than 90% of the children and adolescents who are diagnosed with cancer each year in the United States. They have more than 8,000 physicians, nurses, and experts in childhood cancer who work at more than 200 children's hospitals, university medical centers, and cancer centers throughout the United States and Canada, and at a growing number of international sites. Participate in clinical trials, which are research studies, and help doctors develop better treatments for children. You can also connect them at 1-800-4-CANCER, right? And about getting a second opinion, the doctor would say that he'd tell patients to have their child treated at a hospital that specializes in treating children with cancer, perhaps even the type of cancer their child has. Getting a second opinion helps us make the best decision. We decided to travel to Children's Hospital, that's far from our home, and we're glad we did. So it's about doctor and parents interacting. After you talk with one doctor about your child's diagnosis, treatment plan, you must choose to get another doctor's opinion. This is called getting a second opinion. Most doctors would support and understand your interest in seeking a second opinion. Sometimes insurance companies require a second opinion. Your insurance company can also tell you what steps to take in order to get a second opinion. A second opinion is especially helpful when the first opinion on the treatment plan comes from a doctor who doesn't specialize in or treat many children with the type of cancer that your child has. They are complicated medical decision that needs to be made. There are different treatment options to choose from. Your child has a rare cancer, and with these in mind, the second opinion should come from a pediatric oncologist, preferably one who treats children who have the type of cancer that your child has. This doctor will usually have the most experience with and the most knowledge about the latest treatments for some types of childhood cancer. It may be important to seek a second opinion from a subspecialist such as an oncology orthopedic surgeon. If you choose to seek a second opinion, you will need to get important medical test results and reports from the first doctor to share with the second doctor. The second doctor will examine your child and review the pathology reports, slides, and scans before giving treatment recommendations. The second doctor may agree or disagree with the first doctor's opinion. If the second opinion differs from the first opinion, both doctors should explain why their proposed approach is better and how it is supported by medical evidence, such as the results of clinical trials for this type of cancer. Right, having a pediatric oncologist or other subspecialist review your child's case can ensure that all aspects of care and treatment are considered. Often, the doctor who talks with you about the treatment plan will first review and discuss your child's case with other doctors at the hospital. This is called a tumor board review or a multidisciplinary opinion, so that the treatment plan reflects a consensus of the best approach for your child's treatment from a team of doctors. Places to go for help and find a second opinion include a hospital that is a member of the child's oncology group, the Pediatric Oncology Branch at NIH Clinical Center, one at 1877 624 4878. Specialists who care for children with cancer. And as the vision says, we got to know the people on our child's healthcare team. These specialists worked together to treat a child. In the beginning, we wrote down names and took pictures to help us keep track of them all. We also give them a photo of our family. And now many different specialists work together to treat children with cancer. Your child may see some of the specialists listed below. Use this list to keep track of their names and contact information of the people on your child's team. Doctors who treat children with cancer include the attending physician, who is usually a pediatric hematologist or pediatric oncologist. So the pediatric oncologist is a doctor who treats cancers of the blood and related blood disorders in children. Name and contact information. Pediatric oncologist is a doctor who treats children with cancer. Name and contact information. Other doctors your child may see include neurologist, radiologist, and neurosurgeon, orthopedic surgeon, pain specialist, palliative care specialist, pediatric neuro-oncologist, pediatric psychiatrist, pediatric psychologist, radiation oncologist, a radiologist, pediatric surgeon, a urologist. Other specialists who help care for children with cancer include child life specialist, a health professional who is trained in the emotional and developmental needs of children, education coordinator, a teacher at the hospital who helps your child with academic work and may also coordinate schoolwork with your child's teachers, nurse practitioner, also called an advanced practice nurse, a registered nurse who has additional education and training in how to diagnose and treat disease, pediatric nurse specialist, a registered nurse with an advanced degree in nursing who specializes in the care of children, case management nurse, a registered nurse with special training in how to plan, manage, and evaluate all aspects of patient care, especially for patients who receive treatment over a period of time, name and contact information. Physical therapist, a physician assistant, registered dietitian, social worker, spiritual leader, spiritual care worker, pastoral counselor, or religious leader. Those who are trained to give special advice and counseling. Questions to ask when choosing a hospital. About the hospital, doctor and other members of the healthcare team. Is this hospital a member of the Child's Oncology Group, COG? How long have you been a board-certified pediatric oncologist? Are you on the doctor who will treat and care for my child? Do you specialize in treating the type of cancer that my child has? Who are the other specialists that will be on my child's healthcare plan? About the treatment plan. To learn more about treatments for your child, you may refer to the list of questions to ask about clinical trials section on page 28 and list of questions to ask about your child's cancer center on page 32. About support services for your child. In support services for your child, what specialists and services are available to help my child both physically and emotionally? How often will my child see specialists? What counseling and copying services are available? What integrative medicine practices are offered? This can be seen from the practice list of where the practices that help children section page 76. What fertility preservation procedures do you have available or recommend? What type of academic support would my child have access to at this hospital? What activities and facilities, such as an activity room or computer room, are available? What services for the family? What programs and specialists does one have available to help parents and siblings cope? What are your visitor and overnight policies? What food services do you offer? Where do your family stay? Would it be possible to talk with other parents who have a child treated at this hospital? About practical and financial issues, what type of insurances do you accept? What costs are covered? What costs do we need to pay for upfront or out of pocket? Do you account for counseling and support for financial and insurance related issues? Welcome with your child's healthcare team. We got to know our child's doctor. She was so open with us, took the time to explain things and encouraged our son to ask questions so he understood everything too. Excuse me. We all work together as a team to help our son. You and the people on your child's healthcare team will work together a great deal over the coming months. These suggestions can help you and your child to establish a strong and effective relationship with people on your child's healthcare team. Suggestions to consider as you work with your child's healthcare team. Build a strong partnership. Give and expect to receive respect from the parents, people on your child's healthcare team. Open, honest communication with all will also make it easier for you to ask questions, discuss options, and feel confident that your child is in good hands. Advocate for your child. You know your child best. When you notice that your child is having a difficult time, ask for extra help. Take advantage of the many specialists who can help your child. Your child's healthcare team has expertise in helping children during treatment for cancer. Work with them to help your child learn about cancer, how it will be treated, prepare for tests, manage side effects, and cope. If you get information online, make sure that the source is credible. Although many parents look for information online, some are more comfortable getting information from the doctor and feel overwhelmed or fearful about doing their own research. What is important is to get accurate information that your child can undergo and use to make decisions to help your child. Get recommendations for websites, books, and videos. Share what you find with your child's healthcare team to confirm and the resources that are relevant to your child. Visit the hospital's library or resource center. Meet with a librarian or health educator. Make sure you understand important information. It can be overwhelming to take in and remember new medical information. Speak up when something is confusing or unclear, especially when decisions need to be made. Ask to see pictures or videos to help understand new medical information. Visuals are especially appreciated by children as well. Take notes or ask if you can record a conversation with the doctor so you can listen to it again later. Go with a family member or friend when you talk with your child's doctor. They can take notes, ask questions, and help you remember important information. Keep your child's pediatrician updated. Ask for updates to be sent to your child's regular pediatrician. Practical steps to take for doctor visits. Before and between visits, prepare for each visit. Make notes to help you remember important information you want to discuss with your child's doctor. Use a notebook or computer to keep information organized in one place. Write down questions and concerns as they arise. Make note of any changes you notice in your child, both physical and emotional. Bring your questions and notes with you to the doctor's visit. Put the most important questions first on the list. During the visit, include your child in the conversation. Let your child talk and ask questions. If you or your child does not understand something, speak up. Take notes or ask to record the visit so you can remember important information. Tell your child's doctor about all medical and emotional changes that you noticed in your child. Find out what urgent medical problems you should watch for. Know what problems can be managed at home and which require urgent medical care in an emergency. Got the names and phone numbers of people on your child's healthcare team. Make sure you know who to call at times, including nights and weekends. If you still have more questions, ask to schedule another visit or a follow-up call. After the visit, call about any problems, concerns, or changes you notice between visits. Continue to track using a notebook or computer to test results, medicines, and treatment that your child receives. Related resources: location of child's oncology group hospital, COG, how to find a doctor or treatment facility, and cancer, insurance, and adolescents. Clinical trials. Ask questions and learn about the best chance for curing the type of cancer your child has. It might be a clinical trial or it might not be, but you won't know unless you ask. So it's decided that a new treatment be given through a clinical trial was the best choice for the child. Now, many children with cancer who have treatment options, including standard medical treatment in a clinical trial. Standard medical care, also called standard of care, is treatment for experts agree if that experts agree is appropriate and accepted for a specific disease. Clinical trials, also called clinical studies, are a type of research study that tests new medical approaches in people. Some cancer clinical trials compare a new treatment or a new way of giving a standard treatment with a standard treatment to see if it works better or has fewer side effects. Others to determine the best amount of a drug for you to give. It is important to learn about all the treatment options available for your child. Most children with cancer receive treatment through participating in a clinical trial. The higher clinical trial participation rate accounts for much of the progress in treating childhood cancers. In some cases, clinical trial results have led to treatments with fewer or reduced side effects. Other times, a clinical trial may help doctors learn about the best dose of a medicine. Once a new treatment has proven safe and effective in a clinical trial, it may become the standard of care. Another patient says that I called 1-800-4-CANCER to get information for clinical trials and that were open for the type of cancer my child has. This helped us talk with the child's doctor to learn more. Commonly asked questions. What are clinical trials? How can clinical trials help with children with cancer? Are there possible risks in taking part in a clinical trial? Who sponsors and approves clinical trials? Who pays for the cost of a clinical trial? How can my child get into a clinical trial? What is informed consent? And the next would be, what is the assent process? And after that would be the clinical trial phases. Now we're going to the commonly asked questions. What are clinical trials? Clinical trials are a type of research study that tests how well new medical approaches work in people. Clinical trials can test new ways to prevent, detect, diagnose, or treat a disease. This section focuses on clinical trials or treatment for children with cancer. How can clinical trials help children with cancer? Several benefits of taking part in clinical treatment. Clinical trial include being among the best to receive a promising new treatment that may not be available outside of a clinical trial. Taking part in research that may help others who will never need cancer treatment in the future. Receiving high-quality care, including close monitoring from a healthcare team that is skilled in the latest practices of caring for cancer patients. Are there possible risks in taking part in a clinical trial? Possible risks and or inconveniences from taking part in a cancer care treatment clinical trial include receive a treatment that has unexpected side effects or may turn out to be no better or even worse than the standard treatment. Being required to make more visits to the doctor for tests and checkups. Who sponsors and approves clinical trials? Many different organizations, including the National Cancer Institute, NCI, drug companies, universities, and medical institutions, sponsor cancer treatment clinical trials for children. Each clinical trial sponsor has procedures for approving the clinical trials that it supports. For example, the approval process for NCI-sponsored KORAH clinical trials includes a review by childhood cancer experts to ensure that the treatments are appropriate and that the research questions are a high priority for the cancers being studied. In addition to the sponsors' review and approval procedures, a group called an Institutional Review Board, IRB, must also approve the detailed plan or the protocol for every clinical trial before it can begin. IRBs, which include scientists, doctors, members of the clergy, and patient advocates, make sure that the clinical trials are well designed, ethical, and legal. The review boards also monitor the safety and progress of the trials. Who pays for the cost of the clinical trials? The two types of costs associated with a clinical trial are patient care costs and research costs. Patient care costs are expenses that are part of normal cancer care, such as doctors' fees, routine laboratory tests, and hospital stays, for example. These are usually covered by an insurance company. Research-related costs are items such as the drugs being studied, laboratory tests that are part of the research plan, and the research team's time. The clinical trial sponsor generally pays for these. Costs that may not be covered by either the insurance company or the sponsor include expenses or for travel, hotel costs, and other related personal expenses, for example. Always check with your insurance company and the hospital sponsor to find out which costs they cover and whether there any other costs will not be covered. How can my child get into a clinical trial? To get into a clinical trial, children first need to be evaluated to see if they meet the requirements for trial participation as outlined in the study protocol. These requirements, also called eligibility criteria, may limit trial participation to people who have a specific type and stage of cancer or those in a certain age range. Many large children's hospitals and university hospitals participate in childhood care, cancer care clinical trials. Ask your child's doctor about clinical trials that your child may be eligible to participate in. What is informed consent? Informed consent is the process by which you will be given a detailed explanation about a clinical trial to help you decide if you want your child to participate. This process is carefully designed to protect the rights, safety, and privacy of children participating in clinical trials. As part of the informed consent process, the doctors and nurses on the research team will answer all of your questions about the trial. The informed consent document includes information about the name and purpose of the trial, of the clinical trial, the tests and procedures required by the clinical trial protocol, the treatment type received in the clinical trial, including and when, for how long treatment will be given, and how it compares to the current clinical standard treatment, the possible benefits and risks of participating in the clinical trial, and any new information about the trial that might affect the decision to join or continue the trial, other treatments that are available, your rights such as the right to decide whether or not to have your child participate, as well as your right to withdraw your child from the trial at any time. Key contact information, including the names of the persons in charge of the clinical trial, the principal investigator or PI, and others on the research team. If you choose to have a child participate in a clinical trial, you will be given an informed consent form, which includes written details about the information that was discussed with you and generally describes the privacy of a child's medical records. You will have to sign this form to show that you agree to have your child take part in the clinical trial. Your child's doctor will also sign this form. However, the informed consent form is not a contract, and you may withdraw your child from the clinical trial at any point of time. What is the assent proposal? Your child will also be given information about the clinical trial and what to expect during the treatment in a process called the assent process. Like the informed consent process, the aim of the consent process is an ongoing interactive conversation between the research team and the child. Although formal agreement of consent for a child's participation in a clinical trial comes from the parents rather than the child's agreement to participate assent may also be required. During the assent process, your child will be given age-appropriate information about the purpose of the trial, what procedures they would undergo. The information will be given a variety of ways depending on the child's age, including written forms, conversations, question and answer sessions, online videos, diagrams, and drawings. It is important to understand and carefully consider all of the treatment options available for your child. Getting a question answered can bring you to a place of understanding where you can make the best of your child. Best decision for your child. The list of questions to ask about clinical trials section on page 28 may be helpful. Clinical trials and trial phases. Clinical research is conducted in a series of steps called phases. Each phase aims to answer specific medical questions. During early phase clinical trials, doctors learn about the safety, side effects, and best dose of a new treatment for a specific type of cancer. In later years, doctors study whether the treatment works better than the current standard therapy and the long-term safety of the effectiveness of a treatment. Phase 1 is the treatment safe. Phase 1 is the treatment safe. Phase 1 clinical trials ask, what is the dose or amount of treatment that can be given safely? What is the best way to give this treatment? For example, should it be given by mouth or by injection into a vein? What are the side effects? As the patient, as an opinion is being projected here, Gabby's daughter helped us find a clinical trial that was testing a new drug. We believe this is her best chance. It's also a way to help doctors learn more and to help other children. Standard treatment was not working for our daughter. People who participate in a phase 1 trial often have advanced cancer for which the current standard treatment has also not worked or for which there is no current standard treatment. If a phase 1 clinical trial shows a treatment can be given for safety to people, the best dose identified in the trial will be used in phase 2 trials of treatment. In phase 2, how does this treatment affect the cancer and the body? So, as an opinion states, we decided to enter our daughter in a phase 2 clinical trial with the hope that this treatment would shrink the tumor. Our doctor explained that a phase 1 clinical trial had already determined what amount of the drug should be given. Phase 2 clinical trials asked, does this treatment have an effect in people with a certain type of cancer? What are the side effects of the treatment? Phase 2 clinical trials are the doses that that was found best in phase 1. And phase 2 clinical trials continue to examine the safety and monitor the side effects of this new treatment. They also look for evidence that the treatment may affect the cancer. But a phase 2 trial cannot show for certain that a new drug is effective. Phase 3 trials, how does this treatment compare with the standard treatment? Noel's doctor thought that treatment in this phase 3 clinical trial was as good as and perhaps better than the standard treatment. We had to travel to a hospital that is further from our home, but we were glad to have found a hospital that gave us hope and a doctor that daughter formed a close relationship with. Phase 3 clinical trials ask, how does a new treatment or change to an existing treatment compare with the current standard treatment? Patients in phase 3 are randomly assigned by chance to a control group or intervention group. People who are assigned to this group receive their usual standard treatment for their type of cancer. People who are assigned into intervention group receive the treatment that is being tested in the clinical trial. Random assignment helps people prevent unintended biases that could influence the results of the study, such as assigning sicker patients to the control group. Patients in both groups are monitored carefully during treatment and often for many months after treatment. In some clinical trials, both the patients and doctors know which group the patient is. In other clinical trials, neither the patient nor the doctor knows which group the patient is in and which treatment the patient is receiving. The latter type of study, also called double-blind randomized clinical trial, is considered the golden standard of scientific evidence for new treatment because the study design minimizes the possibility of the result being due to unintended biases. If the experiment treatment in a phase 3 clinical trial works better and or is safer than the current standard treatment, it will likely become the new standard of treatment. Related resources, clinical trials information for patients and caregivers, children clinical studies, children's ascent, NIH clinical research at trials and you. Questions to ask about clinical trials. About your child's treatment choices, what are all of my child's treatment options? What is the current standard treatment for the type of cancer that my child has? What treatment clinical trials are open to children with this type of cancer? Which treatment would you recommend for my child and why? At what hospital is this clinical trial available? About a specific treatment clinical trial, what is the goal of this clinical trial? How many children are currently taking part in this clinical trial? When did the clinical trial start? How long will it last? What type of treatments would my child receive in the clinical trial? How does the treatment in this clinical trial compare with the current standard treatment? What doctors and specialists will my child see or will see my child? Who will be responsible for my child's care? What tests will my child receive? How often? How might treatment in this clinical and trial affect my child's day-to-day life and activities? What short and long-term side effects might my child have? How long will treatment last? If my child takes part in this clinical trial, how will it affect the choice of future treatments? For what reasons would the child clinical trial be stopped? May I talk with other parents who have a child in this clinical trial? About financial costs. Who is sponsoring this clinical trial? What cost does the sponsor of the clinical trial cover? What costs does my health insurance policy cover? What costs do I pay for? Right. Then we come to cancer treatments and side effects. Well, as another patient says, our daughter's oncologist took the time to go over her treatment plan with us. He answered all of her questions and helped her know what to expect during treatment. We know our doctor is in skilled hands and caring hands. That gives us hope. Today, cancer treatments are helping children to live longer and healthier lives than ever before. This section has information about treatment plans, side effects. The questions to ask about your child's cancer treatment is on section in page 32. We'll see that later. Information is given on the following pages about these treatments: chemotherapy, page 34, radiation therapy, page 38, bone marrow transplantation and peripheral blood stem cell transplantation, page 40, surgery on page 42, immunotherapy on page 43, and targeted cell therapies on page 44. Treatment plan. The type of treatment children receive depends upon the type of cancer they have and how advanced the cancer is. Your child's age and other existing health conditions are also factors. Your child's doctor will go over the details of your child's treatment plan to help you and your child understand it. Often pictures, videos, or drawings are used to explain this, for how treatment works and what to expect. You will receive a written copy of your child's treatment plan with information about the goal of treatment and the type of treatment your child will get, how often your child will get treatment, how long treatment will last, procedures and tests your child will have before, during, and after treatment, possible side effects of treatment, contact information for query, medical pro people pro on your child's health care team, side effects. Your child's healthcare plan team will ask questions. We'll talk with you and your child about specific side effects your child may have and how well they will be managed. Side effects are health problems that happen when treatment harms health issues or organs. Some treatment causes minimal side effects, others can have serious side effects. Treatment is planned so your child has a few side effects. As possible side effects can vary from child to child. even among those receiving the same treatment. Not every child gets every possible side effect of a particular treatment, and some children get few side effects. About fertility preservation, ask your child's doctor whether treatment might affect your child's ability to have children in the future. If your child's doctor says that it might, then it is a good idea to talk with a fertility preservation specialist before treatment starts. Keep in mind that delaying treatment to address fertility options may not always be recommended. Nevertheless, it is important to talk with your child's doctor about the effect that treatment might have on your child's fertility before treatment begins. Your child's age and sex will determine which procedures can be used for fertility preservation. Some of the treatment methods listed below are experimental and still being tested in clinical trials. Fertility preservation methods for girls include shielding the ovaries during radiation therapy. For girls who have gone through puberty, eggs can be frozen. Example, egg cryopreservation before treatment. For girls who have not gone through puberty, the possibility of freezing ovarian tissue cryopreservation before treatment is being studied in clinical trials. Fertility preservation methods for boys include shielding the testicles during radiation therapy, sperm banking for boys who have reached puberty, and testicular sperm extraction and testicular tissue cryopreservation for boys who have not reached puberty. Testicular sperm extraction and testicular tissue cryopreservation, also known as freezing, are being studied in clinical trials. For more information about the fertility preservation or to find a fertility preservation center near you, call the Fertility line at 1-866-708-3378 or visit Onco-Fertility Consortium, which is registered. Another opinion reads, even though our daughter's fertility was far from our minds, the doctor talked with us about how treatment might affect her ability to become pregnant one day. I'm glad that the doctor talked with us. Questions asked about the child's cancer treatment. About treatment for this type of cancer, what treatments are available for the type of cancer that my child has? What treatments do you recommend for my child? What is the goal of this treatment? How will the treatment be given? What happens during a treatment session? And how does this treatment work? What are the risks of this treatment? What are the next steps if my child's cancer does not respond to this treatment? But what percentage of children receiving this treatment are helped by it? About the treatment schedule. How often will my child receive treatment? How long will each treatment last? And where will treatment be given? For example, will my child receive inpatient or outpatient treatment? Will hospital stays be needed? How many treatments will my child receive? How long will the entire treatment plan last? About side effects and support devices. How do children who go through this type of treatment feel both physically and emotionally? What supportive care and complementary practices such as music therapy, acupuncture, physical therapy, and guided imagery are available to help my child feel better? What side effects may happen during treatment? How long will these side effects last? How will the child healthcare team work to reduce these side effects? What can I do to help my child feel better? What permanent or lasting side effects might my child have after treatment is completed? Will my child's fertility be affected? What are the opinions to preserve my child's fertility? About making a decision. When do we need to choose type of treatment? When do we need to choose type of treatment? When does my child need to start treatment? What procedures should my child have before starting treatment? For example, should my child have a dental checkup? Should my child and others in the family receive or avoid any vaccines? Related resources, Pediatric Cancer Treatment Summaries, Preserving Fertility in Children with Cancer, Onco-Fertility Consortium, Side Effects. Now we're going into chemotherapy. A daughter's nurse helped her through chemotherapy, telling her what to expect and helping her smile. How chemotherapy helps. Chemotherapy is treatment with drugs to stop or slow the growth of cancer cells. Chemotherapy works by destroying cells that are in the process of dividing. Most cancer cells divide rapidly, so they are the cells that are most likely to be destroyed by chemotherapy. However, some types of healthy cells also divide rapidly, which means that they can be destroyed by chemotherapy as well. Most chemotherapy drugs travel through the bloodstream, as so they will eventually reach cells all over the body. How chemotherapy is given. The most common way the chemotherapy is given are through an IV intravenous line into a vein, as a pill, capsule, or liquid that is swallowed, oral chemotherapy. More about intravenous chemotherapy. Now, if your child is receiving chemotherapy through an IV line, then she will most likely have a catheter inserted into her body. And a catheter is a thin, flexible tube that is used to give chemotherapy and other drugs, blood transfusions and intravenous fluids, and to take blood samples. Types of catheters include port or cath, port or subcutaneous implantable port. This type of catheter is a small round disc made of plastic or metal with a silicone center. It is inserted under the skin on your child's chest during surgery. Your child may be given general anesthesia or placed under conscious sedation during this procedure. And that is the figure for port or cath under skin as the superior vena cava of the heart, inserting the needle into a port or cath. Right? Blood is drawn from a port or cath. Now the port is connected by a catheter to a large vein in your child's chest. Chemotherapy is given through a needle that is inserted through the skin into the port. A numbing cream may be applied to the skin first. The needle is removed after the drugs are given. This type of catheter is completely inside your child's body, so it doesn't require any special care when your child is bathing. It can be left in for a long time, and a child has a lower chance of developing infections and blood clots with a port than with other types of catheter. So port or cath is pretty safe. The other is a central venous catheter. That's a tunnel catheter. This type of a catheter is a thin flexible tube that is inserted through an incision in your child's chest during surgery and then threaded, tunneled under the skin into a large vein near the heart or into the right atrium of the heart. The part of the catheter that is outside the body is taped to the chest and is used to give chemotherapy, so needle sticks are needed. Right? And this type of catheter can be left in place for a long period of time. It needs to be cleaned, flushed every day. Care needs to be taken so it does not get pulled out or wet. There is a small chance of infection and blood clots with this type of catheter. So we've talked about port or cath and central venous catheter. So port or cath is the safest. The third one is peripherally inserted central catheter, PICC. This type of catheter is a thin, flexible tube that is inserted into a vein in the upper arm and guided into a large vein near the heart. This type of catheter can be inserted by a nurse and does not require surgery. The part of the catheter that is outside the body is taped to the skin on the arm and is used to give chemotherapy. This type of catheter avoids the need for repeated needle sticks and can stay in place for a long time. It needs to be cleaned, flushed every day. Care needs to be taken so it does not get pulled out or wet. There is a small chance of infection and blood clots with this type of catheter too. And catheters may be used for chemotherapy as well as to give other medicines and for blood draws and blood transfusions. Side effects of chemotherapy. Chemotherapy destroys cells that grow and divide quickly. Cancer cells grow and divide quickly, but so do some healthy cells, such as cells that line the mouth and stomach and cells that make hair grow. Sometimes chemotherapy can slow or destroy cells in the bone marrow that make blood cells. Damage to these healthy cells cause side effects. Side effects differ greatly depending upon the type of chemotherapy, drugs that your child is receiving. Common side effects. Common side effects of chemotherapy may include fatigue, nausea, diarrhea, mouth sores, hair loss, anemia, and increased risk of infection. You may find the practical tips, the chemotherapy side effects series helpful as you talk with your child's nurse to learn more. Late effects are problems that may happen months or years after treatment. You may want to ask your child's doctor about possible late side effects for the type of treatment. that your child is receiving. You can learn more in the long-term and late late effects. Special precautions you may need to take. As another patient comments, John is getting a type of chemotherapy that has made it very important to take safety precautions at home. A child's nurse, whenever these instructions such as wearing gloves at certain times and washing soil sheets separately, make sure you understand the instructions from your nurse and keep them handy. Many chemotherapy drugs are harmful to healthy people. You may need to take precautions if you are giving your child chemotherapy at home. Talk with your child's doctor about these and other precautions you may need to take. Take care not to touch all chemotherapy drugs such as pills, capsules, or liquids. Body fluids such as vomit, urine, stools, or blood from your child. Items that are soiled with chemotherapy drugs or with body fluids such as clothes or sheets. Wear gloves if you're in contact with soiled items or body fluids. Wash soiled items such as the countertop, bedpan, or bucket with soap and hot water. Wash soiled items apart from the rest of the laundry. If you cannot wash soiled items right away, put them in a sealed plastic bag. Wash soiled laundry on the hot water cycle of the washing machine. Run the load twice. Double bag all soiled disposable items such as used gloves. Ask your child's nurse how to dispose of soiled items. You may need to put them into special waste bags or containers marked hazardous and bring them back to the hospital for disposal. Questions to ask about safety precautions, about taking necessary precautions to stay safe. What special care and precautions should I take when caring for my child? What should I avoid touching or coming into contact with for how long? How should I dispose of soiled items? What should I do if I touch soil items or body fluids? What are the problems? About preparing oral chemotherapy, where should I keep and store the oral chemotherapy drugs? What should I wear a mask and gloves when handling these drugs? How often do I give these drugs to my child? What should I do if my child vomits? Should the drug be taken with or without food? Should pills be swallowed whole or can they be crushed? If the pill can be crushed, what should I use to crush it? How should I clean utensils, countertops, and other items used? What other precautions should I take? Related resources, chemo, craziness, and comfort. My boss took about childhood cancer, chemotherapy. My book about childhood cancer, chemotherapy side effects. Next is about radiation therapy. Our child is such a curious kid. He always has questions. He wants to know what's going on to happen today and how does it work. Talking with his child life specialist has helped a lot. So has reading together about treatment works. So that's a pretty smart child. Now, how radiation therapy works. Radiation therapy uses high energy radiation to destroy cancer cells and shrink tumors. External beam radiation therapy is the most common type of radiation therapy used to treat cancers in children. Other types include internal radiation therapy and systemic radiation therapy. And external beam radiation therapy uses a machine that aims radiation at the cancer. Lead shields protect the parts of a child's body that are not receiving radiation. All young children may be given medicine that helps them relax, stay still, or sleep during treatment. The machine that delivers the radiation is large and noisy, and it will rotate round but will not touch your child. This type of radiation is usually given every day for several weeks. Although each treatment session may last 30 minutes to an hour, most of the time is spent getting your child in the correct position. So your child will most likely receive radiation for only 1 to 5 minutes during each visit. Internal radiation therapy or brachytherapy uses a radiation source that is sealed in seeds, ribbons, or wires. The radiation source is placed inside the body near the cancer cells and may be left in place for minutes, hours, or days, depending on the type of brachytherapy. Sometimes the radiation source is left inside the body permanently, even if it is no longer giving off any radiation. Systemic radiation therapy. is a type of radiation therapy in which a radioactive substance is swallowed or injected into the body and travels through the blood to destroy cancer cells. One example is radioactive iodine, which is used to treat some types of thyroid cancer. Getting on to the side effects of radiation therapy. Now, getting ready for external beam radiation therapy. As a side note, before receiving external beam radiation therapy, your child will need treatment planning session called a simulation. So detailed scans are taken of the tumor and the area of the normal tissue around it. Small marks, often dots of ink, put on the skin to show where to aim the radiation. If needed, a body mold or mask is made to help your child stay the exact same position during each treatment. And the treatment starts step by step